What does vitamin K2, menaquinone, do for your bones? Imagine your bones as a busy construction site where new building blocks are constantly being laid down and old ones removed. This ongoing process, called remodeling, keeps bones strong and healthy. As we age, especially after menopause, this balance can shift, leading to weaker bones and a higher risk of fractures. That's where vitamin K2, also known as menaquinone, comes into play. It's a fat-soluble vitamin that plays a vital role in maintaining bone health by helping regulate how calcium is used in your body. Vitamin K2 activates certain proteins that are essential for bone formation. One of these is osteocalcin, a protein produced by cells called osteoblasts that build bone. For osteocalcin to do its job properly, it needs to be carboxylated, which means it must undergo a chemical change that allows it to bind calcium effectively. Vitamin K2 acts as a cofactor in this process, helping osteocalcin attach calcium to the bone matrix. Without enough vitamin K2, osteocalcin remains inactive, and calcium may not be incorporated into bones properly, which can weaken their structure. In addition to its role in activating osteocalcin, vitamin K2 helps direct calcium to where it's needed most, your bones and teeth, rather than allowing it to deposit in soft tissues like arteries. This dual function supports both bone strength and cardiovascular health by reducing the risk of harmful calcification in blood vessels. Research on vitamin K2's effects on bone health has shown promising results, especially in postmenopausal women who are at higher risk for osteoporosis. Some studies suggest that supplementing with vitamin K2, particularly in the form of MK7, at doses around 90 to 180 micrograms daily, can slow down bone loss and improve bone mineral density in key areas like the spine and hips. When combined with adequate calcium and vitamin D, vitamin K2 may help reduce fracture risk. However, not all studies show consistent benefits, especially in people who already get enough calcium and vitamin D through diet or supplements. This indicates that vitamin K2 might be most helpful when there is a deficiency or as part of a comprehensive approach to bone health. It's important to remember that vitamin K2 is not a cure for osteoporosis on its own. Medical guidelines recommend a combination of strategies for preventing and managing osteoporosis. These include eating enough calcium and vitamin D, engaging in weight-bearing exercise, preventing falls, and, when necessary, taking prescribed medications. Vitamin K2 can be a helpful addition, especially for those with low dietary intake, but it should not replace standard treatments. To include more vitamin K2 in your diet, consider foods like fermented products such as natto and certain cheeses, as well as some animal products like liver and eggs. Some foods are fortified with vitamin K2 as well. If you are concerned about osteoporosis or at high risk, it's best to talk with your healthcare provider. They can assess your individual needs and determine if vitamin K2 supplements are appropriate for you. In summary, vitamin K2 supports bone health by activating proteins that help bind calcium to bones, maintaining their density and strength. While research shows it has potential benefits, especially in preventing age-related bone loss, it works best as part of a balanced approach to nutrition and lifestyle. Always consult a healthcare professional before starting any new supplement, especially if you have osteoporosis or are at risk for fractures.